He's spoken all over the world, and today we have him here with us. So I invite to the stage Dr. Robert Malone. He is here on behalf of Children's Health Defense. He would like to invite the children to come and sit up closer to the stage. So if there's cakey out there, please feel free to come closer to the stage.
Yeah, please, young people, please come forward, because this is really about you. This is about the children. The children are our future. We have to protect the children. So I want to lead by just saying aloha, Oahu, and thank you so much for the opportunity to share today with you. And I want to say Oahu is the home of the brave, and this crowd proves it. I mean, they're doing all kinds of stuff to shut us down, all kinds of stuff to slander us, all kinds of stuff to scare us. The fear is constant coming at us. And you know who suffers most? The children. They don't care about the children. I cannot believe what's going on. We have the children here, and so I don't want to speak about what's happening to them, but it is tragic. You know it. The fear and the masking and all of the threats and think about what it's like to be a child. For me, I grew up in the early 60s, and at that time, the fear was all about the bomb. And the people around me and my parents had bomb shelters. And we had special practice to hide and duck under our tables in case the bomb came. Okay? That was bad enough. But compared to what these young people, these future leaders of Hawaii and our society and our culture experience right now, what I experienced was nothing. And we have to stop this. So my friends, please don't be afraid. No fear. And I'm going to tell you why. Okay? No fear. Do you hear me? All of you? You don't have to be afraid. Why don't you have to be afraid? Because your immune systems are better than the immune systems of grown-ups and old farts like me. That's the truth. It's the honest truth. That's the scientific truth. Okay? So I'm speaking from the heart to you. Please hear me. You do not need to be afraid. Okay? Be brave. It's going to be okay. Now, of course, I'm having trouble reading my notes because of it's gone a little while. I'd also like to make the point that you have the right to choose. Okay? And I'd like to echo the overall theme, thank you very much, the overall theme of the organizers here, which is freedom for all. I mean, what's if you think about it, in the end, well, let me put it this way. When I started on this journey, I thought this was going to be about bioethics. And I would speak about bioethics, and I would try to help the government recognize the importance of bioethics and the importance of the Nuremberg trials and the Nuremberg Accord and the Helsinki Accord and all of that stuff that's happened ever since. They didn't care. They didn't listen. It doesn't matter to them. They don't think they have to play by those rules. And then as time went on, I realized this was no longer about that. It wasn't about the vaccine, and it wasn't about the virus. It was about liberty. It was about freedom to choose. It was about the rights of individuals as opposed to the rights of the government to impose things on the name of the collective. I really, really strongly believe that it's your right to control what goes into your body. And this is not a radical idea. I mean, this is an idea that has been with us for decades. It's one of the things we settled after World War II. We agreed that this was going to be the rule in the West. And now suddenly there's this strange belief that it's okay to force people to take medical procedures and medical products, and even worse, to take experimental medical products. Even worse, to force our children to take experimental medical products. What is going on? This is just not right. Now, another thing that we've seen has to do with integrity. And I think integrity is kind of an important word here, because what we've also seen play out over the last 2 years is what the government calls the noble lie. Okay? The idea that it's okay to lie to us because we don't know enough. We can't handle the truth. And this is what's justified all of the lying that's gone on. Again and again and again, coming from our government, where they tell us, wear the mask, don't wear the mask, wear the mask, mask will save you, you must wear the mask. You know, they tell you, you will get to herd immunity if only 70% of you will take the vaccine. And then it's 80%, and then it's 90%. And then Dr. Fauci gets interviewed and he says, they ask him, well, how come you said 70% back then? He says, well, because I didn't think the public could handle the truth. Oh, you poor things. I mean, I'm a little tired of being treated like I'm 8 years old. I think we're all grown-ups. We can handle the truth. So stop lying to us and act with integrity. Now, there's another thing I want to hit really quick at the top. I really don't like conspiracy theories. I try hard to stay based in fact, but I'm forced into a position of recognizing that we're in the middle of information warfare. Like, I remember back a few years ago when we all heard about how bad things are for people in China, how bad it was that China was setting up to filter information coming through the internet, and that they wouldn't let people hear things over the internet that they didn't want them to hear, and they would block information, and they would attack people that said things on social media that they didn't like. You remember that? It was just a few years ago. I remember it, thinking to myself, those poor Chinese people. What an awful world to live in, to have this government do this to you. And here we are. Okay? And where do we go from there? Okay, the truth is that in China they have these social, programs now where you're rated in terms of your contribution to society, and you're given rights or have your rights removed to travel and to purchase things and to go on vacation, to travel to resort areas, to buy groceries. Are we going there? I don't know. But 2 or 3 years ago, I never thought we would see censorship in the United States. I never thought we would see overt propaganda pushed by the government through all of our social media and through the internet. Yet here we are. What comes next, I don't know. But I'm pretty sure that this is full-on information warfare like we've never seen. And I've been traveling all over the globe and speaking to people in countries all over the world, and the bizarre thing is that they're all experiencing the same thing. Their media is doing the same thing to them. Their media is hunting physicians that speak out, just like our media is doing it. I went to Rome and I participated in a conference. The conference focus was on early treatment for patients, things that can be done to save people's lives. We had this conference, and in the Italian press, I was labeled a terrorist for advocating for trying to save people's lives. That's what we've come to. Okay, so let's recognize where we really are. Now, in addition to being in the middle of information warfare, we're constantly bombarded by fear. And there's a recent poll out showing that a large fraction of our overall population believes that they're at extremely high risk for death or disease from this virus. I'm here to give you the truth. For most of you, the healthy ones, your healthy kids, The probability of hospitalization or death from this virus is a fraction of 1%. It's tiny. Okay? So, I'm sorry CNN, I'm sorry New York Times and Washington Post, but we don't need your fear, okay? And we sure don't need that fear pushed onto our children anymore. Thank you very much. Now, the next thing I'd like to talk about is informed consent. Informed consent is a concept that's actually coded into federal law. We call it the common rule, and if I wanted to get technical, I could cite the specific part of the Code of Federal Regulations. Informed consent has three main components. The first component is there must be full and complete disclosure of risks, particularly for experimental products. The second component is that those risks have to be described in common language. It can't be hidden using fancy science-y terms and medical terms. You've got to be able to understand those risks. And here's the kicker, okay? No coercion, no compulsion, no enticement, no free ice cream so that the kids can get their jabs without the parents' approval, okay? That is all forbidden, particularly for experimental products. Now, do we have any licensed vaccines? In theory, we do. But can you go to Walmart and get one? Can you go get one from your doctor right now? And particularly, I want to reach out to our military personnel that are here. They're hurting. They're under mandates right now. Excuse me. Those mandates actually are valid. Let's say Mr. Brandon does have the right, that unfortunately does have the right to mandate vaccines for federal employees and military personnel. But the law says after Desert Storm that they can only provide those vaccines, they can only mandate vaccines in military personnel if they are already licensed products. They cannot force experimental products on military personnel. So my heart goes out to all of you. I work with the DoD, I respect the DoD, I far rather work with the DoD than work with NIAID and NIH for reasons that you all understand. And we have clinical trials starting with the DoD with repurposed drugs soon. But I know that many of my colleagues in the DoD and contractors and other federal employees are facing a situation where they're being mandated to either lose their job or accept an experimental product. And I just want to say that's not right, it's not proper, it's not fair, and it's not legal. So, 3 points to informed consent. There has to be full and complete disclosure of risks. That can't happen because we don't know them all yet. How do we know that we don't know them all? Because the FDA has said so. In the licensure for the BioNTech product, it explicitly says we don't yet know what the risks are in pregnancy. We don't know what the risks are for birth defects. You're going to have to do special studies to characterize those things. So when they tell you that it's okay to take the vaccine when you're pregnant, I think you ought to tell them back, show me the data. Okay? Because they don't have the data. Because they've just started doing the studies. The studies just got funded about a month ago, okay? And it takes a little more than a month to have a baby. Okay, so let's just chill out a little bit. And my advice to you, I'm not saying the vaccines are unsafe or they are safe in pregnancy. I'm saying we don't have the data. And in the absence of the data, the right thing to do is wait until we do know. Okay? Now I want to talk about the 3-point plan. We call it the Maui Plan. We've also called it the Global COVID Summit Plan. It's a 3-point plan for how to proceed from here, in my opinion. And this is a consensus plan of over 10,000 physicians and medical scientists worldwide. People that have had the courage to sign the Physicians' Declaration of Rome, which says that physicians have the right to practice. And they've come up with a 3-point plan for how to proceed. And it's really simple, okay? So here, listen up, take it home, spread it around. First point, early treatment works. Early treatment includes antibodies like Ron DeSantis has been using in the state of Florida. It also includes a lot of other drugs. Aspirin actually has benefit. The study was recently published. We're about to start testing with DOD, the combination of Pepcid and Celebrex, technically. There are many other agents. There's one that we're not allowed to talk about anymore by the press, ivermectin. There's another one called hydroxychloroquine. Okay, and there's others, fluvoxamine, vitamin D, zinc, zithromycin. There's a lot of agents now, and if you can find physicians willing to prescribe these really, scary drugs that have typically been licensed for, say, 20 to 40 years and have excellent track records and almost no risk, if you can find physicians brave enough to administer them, you can point them towards the Zelenko protocol or the FLCCC protocol, or there's a number of other ones. And I think that you'll find that with early treatment, we can quench this virus just like they did in India, in Uttar Pradesh, where they had a huge spike, and now they have almost none. So early treatment. Second point, I already mentioned before, physician right to practice. I mean, this is heresy, okay? Physicians that are suggesting that they be allowed to practice medicine and treat patients rather than waiting till they get so sick that they have to go to the hospital and their lungs are trashed. What a heretical idea. This clearly can't be right. The NIH doesn't say that you can do this. It's only the thing that physicians have been doing for centuries, okay? But for some reason now, all of a sudden, physicians aren't allowed to do it, and the press is hounding anybody who does, calling us anti-vaxxers, attacking us, doing anything they can to slander us in the press. One hears that there is a state senator in this state called Hawaii that has gone on and insisted that my good friend Lauren Pang, MD, MPH, former Walter Reed Army Research Center, trained as an MD and an MPH on the mainland, that has been serving the island of here in Hawaii for over 20 years as a public health officer, is now being threatened with having his license taken away because he basically read the literature and was advising people in his public health officers on Oahu to do the right thing and not give vaccines to pregnant women. So now we have Lauren Pang, Kurt Milhound, and many other physicians that are being hounded by the press and attacked by politicians here in the state because they're merely offering early treatments and trying to save patients' lives. We have to allow physicians to practice medicine. Now here's the third point and the most important point: no jabs for kids. The virus risks for kids, the truth is that the kids don't get the disease. They don't spread the disease. There is a total of about 400 children in the United States since the start of the outbreak that have been listed as having died from COVID, but in fact, every single one of them had major medical problems. They really died with COVID, not from COVID. That's it, okay? Now, unfortunately, the good news is that the risk of the vaccine in kids is relatively low, but the risk of the disease is even lower. The risk of the vaccine injury, like myocarditis in children, is about 6 times higher than the risk of the virus itself. And myocarditis, they try to tell us in the press, it's nothing, it's transient, it goes away right away. That's not true. That's another lie. Heart doesn't heal, it scars. And children are dying from this vaccine. Okay? So, no jabs for kids. The virus risk is low. The risk of the vaccine is about 6 times higher. And unfortunately, the risks in boys are about 3 times higher than they are in girls. So what we're doing by talking about vaccination for our children with these genetic vaccines is we are saying that we are going to mandate that they take a product that is not safe for them. It's more not safe than the virus itself. Now, people talk about, and this is noble, they talk about, well, maybe you should vaccinate the kids to make sure that we don't infect their teachers and their parents and their grandparents. The data in multiple studies now show that kids generally are not spreading the virus. And furthermore, if the teachers and the parents and the grandparents feel like they need to be protected, they can accept vaccine. So there's, as I see it, there's absolutely no reason that we have to give vaccine to these young people at this point in time. The logic completely fails. Now, I'd like to talk a little bit about the censorship and the propaganda. It is worldwide. What you're seeing in the press, this push to demean people and to push information that's clearly biased. I mean, for example, I'm labeled as a right-wing nutcase, okay? And I'm gonna tell you a little secret, okay? Just because I go on Steve Bannon's show because mainstream press doesn't want to talk to me for some reason. They say I'm a right-wing crazy guy, Proud Boy. So here's the little secret. My wife and I actually donated to the Biden campaign before this. But I'll tell you, like a lot of people, we've been through this now, and I don't know that we're ever going to vote for a Democrat again. I cannot believe what we're seeing. I cannot believe how they want to push this authoritarianism. I cannot believe how they completely disregard the data. This has got to stop, and I don't think there's any way that they're going to stop, except if there's a big change in the next election. Now, I don't like to get political. It's not kind of how I'm wired, but at this point, I don't see any other option. So I suggest you think about that as you go forward. Now, the last thing I'd like to say is get Bobby Kennedy's book. I had to edit it twice. This is the one about the real Tony Fauci, and when you read it, it is going to blow your mind. I thought I really understood the way things work in the government. I thought I was an insider. I thought I understood what happened during the AIDS crisis. I thought I'd understood what happened with remdesivir and the killing of hydroxychloroquine and ivermectin. I didn't know anything. Read the book, okay? It's coming out shortly, and I'm not getting anything from it, but I'm telling you, if you read it, a lot of things are going to make sense. Now, I'd like to close with a real simple statement, and a thank you to all of you for your support. It's overwhelming. But my closing comment is, let's go Brandon, my friends.
Dr. Robert Malone, can you believe we had him here? We're so lucky. What a message. Let's go, Brandon!
Let's go, Brandon!
Let's go, Brandon!
Let's go, Brandon!
Dr. Malone. All right, well, we're almost at the end of the evening. Thank you all for coming out. We hope you enjoyed every second of this. We're so thankful to Casey and Yvette and our sound team working through this whole thing. We have a special last-second spontaneous talk from 2 people from Israel.